Did you know that every year, non-communicable diseases silently claim more lives than all wars, natural disasters, and infectious outbreaks combined? Heart disease, diabetes, cancer. They don't spread from person to person, yet they spread through lifestyles, environments, and the very fabric of modern society. Hello and welcome. Today, we're uncovering the silent epidemic of the 21st century, the wave of non-communicable diseases that is reshaping how long we live, how we suffer, and how public health must rise to fight back. According to the World Health Organization, non-communicable diseases, or NCDs, are chronic conditions that cannot be passed from one person to another. They include cardiovascular diseases, cancers, chronic respiratory illnesses, and diabetes. Unlike infections that burn fast and spread quickly, these diseases creep in silently, often taking years to reveal their full impact. In simpler words, they are the slow killers. They do not come from a single cough or a mosquito bite. They come from how we live, what we eat, whether we move our bodies, and even the air we breathe. Imagine carrying a time bomb inside your body, ticking away day after day, unnoticed, until one morning it explodes as a stroke, a tumor, or a sudden heart attack. NCDs are not distant medical jargon. They are personal, intimate, lurking in daily habits. The cigarette at a late-night gathering, the sugary drink replacing water, the hours spent sitting while the body rusts from within. To understand the epidemic, we must first grasp this. These are not rare anomalies. They are deeply woven into modern human life. Every year, more than 40 million people die because of non-communicable diseases. That's nearly 3 out of every 4 deaths worldwide. Put differently, in the time it takes to watch this video, thousands will lose their lives, not to an outbreak or a war, but to heart attacks, strokes, and cancers that could have been prevented. Consider this. Cardiovascular diseases alone kill around 18 million people annually. Diabetes is no longer a disease of the wealthy. It is exploding across low- and middle-income countries where hospital beds are already scarce. Cancer devastates families, not just with its toll on the body, but also with crushing financial burdens. These aren't statistics on a page. They are empty chairs at dinner tables, children growing up without parents, and parents burying their children too soon. And the tragedy? Many of these deaths are preventable. Risk factors are all around us. Diets heavy in salt, sugar, and trans fats, smoking that poisons lungs and blood, urban air that suffocates with invisible toxins. In crowded cities, stress itself becomes a silent poison, raising blood pressure and breaking hearts long before their time. This isn't just a matter of individual health, it's an economic catastrophe. The global cost of NCDs is projected to surpass trillions of dollars in lost productivity and healthcare expenses. Nations are watching their future workforces slip away, one diagnosis at a time. So the question isn't whether this epidemic matters. The real question is, how much longer can societies ignore a crisis that is eating them alive from within? Non-communicable diseases are not born from chance. They emerge from a web of risk factors that modern life seems almost designed to amplify. The first culprit, tobacco. More than 7 million people die each year from smoking and secondhand smoke. Each cigarette is a calculated theft of years, shrinking arteries, poisoning lungs, leaving behind a trail of strokes and cancers. The second killer hides in plain sight. Diet. Highly processed foods, loaded with salt, sugar, and trans fats, are no longer luxuries but daily staples. Fast food chains stretch across every city block, while cheap sugary drinks flow into schools and homes. These choices carve the path toward obesity, hypertension, and type 2 diabetes. Physical inactivity follows close behind. We live in a world where machines walk for us, screens entertain us, and cities are built for cars, not people. The body, designed to move, rusts in its stillness. Muscles weaken, hearts strain, fat accumulates. What once was survival through activity has become decline through inactivity. And then, the invisible assassin: air pollution. Inhaling toxic air is equivalent to smoking multiple cigarettes a day. It triggers heart attacks, strokes, and chronic respiratory diseases in millions, often without a single warning sign. Layered onto these risks are social determinants: poverty, lack of education, and weak healthcare systems. In many nations, the poor cannot afford healthy food, cannot access preventive care, and cannot escape polluted environments. The result is predictable. NCDs strike hardest at those least able to fight back. Public health frameworks like the Ottawa Charter teach us that prevention requires action at every level: individual, community, and policy. It's not just about telling people to eat healthy or exercise. It is about creating environments where the healthy choice is the easy choice. Cities with bike lanes, schools free of junk food, taxes on tobacco and sugary drinks, and healthcare systems that detect diseases early before they spiral out of control. Yet here lies the irony. These measures are known, proven, and cost-effective, yet too often ignored. The silent epidemic grows not because solutions don't exist, but because political will, funding, and urgency fall short. To truly grasp the weight of this epidemic, imagine placing non-communicable diseases beside infectious ones. When we hear epidemic, our minds leap to viruses and plagues: Ebola, COVID-19, influenza, outbreaks that spread fast, terrify nations, and dominate headlines. Infectious diseases strike with sudden waves. They demand quarantines, vaccines, emergency responses. Their visibility makes them impossible to ignore. Non-communicable diseases, however, do not spread from one body to another. They creep quietly, not in days, but in decades. Instead of a fever that spikes overnight, they manifest as blood pressure rising year after year, or blood sugar climbing until one day it tips into crisis. If infectious diseases are wildfires, NCDs are slow-burning embers, eating away at the structure until it collapses without warning. Public health and clinical medicine also reveal a sharp divide. Clinical medicine treats the individual: a doctor prescribing medication, a surgeon removing a tumor, a nurse checking blood sugar. It saves lives one patient at a time. Public health, on the other hand, moves at the scale of populations. It builds smoking bans, citywide screening programs, and nationwide campaigns to reduce salt in food. Where clinical care fixes the damage, public health prevents the fire from ever catching. But here is the cruel twist. Infectious diseases may terrify us in the short term. Yet non-communicable diseases kill far more in the long run. COVID-19 took millions of lives in a few years, but cardiovascular disease takes 18 million every single year. While pandemics fade from memory, NCDs remain a relentless shadow, tightening their grip with every passing generation. This contrast is what makes them so dangerous. Because they lack drama, they lack urgency. Because they lack urgency, they continue unchecked. And so, the true epidemic of the 21st century is not the virus we fear. It is the lifestyle-driven diseases we ignore. If non-communicable diseases are born from the choices and environments around us, then the fight against them must be waged on every front: personal, communal, and political. At the individual level, the weapons seem deceptively simple. Replace sugary drinks with water. Swap processed meals for fresh foods. Commit to 30 minutes of movement a day, whether it's walking, cycling, or dancing in your living room. Avoid tobacco, limit alcohol, and treat your body not as a machine to be driven into the ground, but as a vessel to be preserved. These are not radical changes. Yet, multiplied across millions, they save lives by the millions. Communities play their part too. Schools can ban junk food and integrate health education into every lesson. Workplaces can encourage physical activity, turning staircases into invitations instead of afterthoughts. Urban planners can design cities where cycling is safer than driving, and green spaces are not luxuries but necessities. A community designed for health builds habits without its people even noticing. But the heaviest responsibility lies with governments. Policies change behaviors on a scale that no single doctor's advice ever could. Tobacco taxes reduce smoking rates. Bans on trans fats cut heart disease deaths. Regulations on advertising junk food protect children before habits can root. Universal health care ensures early detection, catching hypertension or diabetes long before they explode into catastrophe. The lesson is clear. Defeating NCDs is not about asking individuals to swim against the current. It's about changing the current itself. A world where the healthier path is not the harder one. A society where prevention is not a luxury, but the foundation. And in truth, the question is not whether we can act. The science is there. The solutions are proven. The real question is whether we will act before the silent epidemic becomes the dominant story of human survival. So what have we uncovered about the silent epidemic? First, non-communicable diseases are not rare medical curiosities. They are the #1 killers of our time, claiming over 40 million lives each year. Second, they do not spread through germs, but through habits, environments, and inequalities that shape how we live and how we die. Third, they are preventable. With healthier diets, active lifestyles, clean air, and strong public health policies, millions of lives could be saved every single year. Think back to the opening question. More people die from NCDs than wars, disasters, and outbreaks combined. That shocking fact is not just a statistic. It is a call to action. It is a reminder that the greatest threats to our future are not always the ones that dominate headlines, but the ones that erode us quietly, persistently, invisibly. In this silent epidemic, knowledge is our shield, prevention is our sword, and collective action is our only path forward. If you found this video eye-opening, don't let the message fade into silence. Share it with someone you care about, because knowledge, like disease, spreads. But unlike disease, knowledge saves lives. Subscribe to this channel for more deep dives into the hidden forces shaping global health. And in our next video, we'll uncover another threat that rarely makes the front page, but affects millions every single day. The epidemic of non-communicable diseases is silent. Yes, but together, we can make our response louder, stronger, and impossible to ignore.